Let us start with the development of the mucous membrane of the tongue. The development of mucous membrane of the tongue occurs by lot of swellings which develop within the floor of primitive pharynx. These swellings include the lingual swellings and tuberculum impar, which are derived from the first pharyngeal arch. Then the next important swelling we have is the copula of His. The copula of His is specifically derived from the second pharyngeal arch, but this does not give rise to any important component of the tongue because it gets buried. How? We will see. Then the main third and the fourth arch components develop as one midline swelling called as hypobranchial eminence, right. So, these hypobranchial eminence is mainly derived from the third and the fourth arch component. Fusion of these different lingual swellings leads to the development of mucous membrane of the tongue. How? The fusion of lingual swellings with the tuberculum impar will give rise to the mucous membrane of the anterior 2/3 of the tongue. The mucous membrane of posterior 1/3 of the tongue is derived from the third arch component of the hypobranchial eminence. The fourth arch component gives rise to the mucous membrane of the posterior most part of the tongue. Now, where is that component that has come from? The second arch, and we called as the copula of His. The copula of His gets buried by the overgrowth of the third arch component of the hypobranchial eminence. That is why we do not see any component of the mucous membrane of the tongue which actually develops from the second arch. This is how we must briefly describe the development of the mucous membrane. The development of the mucous membrane again is directly related to the innervation. Fine, we will talk about when we discuss about the embryological basis for innervation. The separation of anterior 2/3 and posterior 1/3 of the mucous membrane is represented by foramen cecum in the center and sulcus terminalis which extends from it. Are we clear? So, this is regarding the development of mucous membrane of the tongue. How do muscles of the tongue develop? The muscles of the tongue develop from occipital somites except for palatoglossus. The palatoglossus muscle is believed to develop from the mesoderm of the head and neck or the mesenchyme of head and neck. So, this is what you must write in the development of muscles of the tongue. What about the development of connective tissue? Even the connective tissue component of the tongue develops from the mesenchyme of head and neck. So, this is how different parts of the tongue develop from different germ layer derivatives, right. So, this is how you must describe the development of mucous membrane, muscles, follow it up with development of connective tissue. Then, what about development of the lingual papillae and taste buds? The lingual papillae starts appearing from 8th week of intrauterine life. The first lingual papillae to appear are the folate papillae and the valate papillae. The valate papillae which are located in front of the sulcus terminalis, and then the folate papillae which are located on the margins, right. Then this is followed by the occurrence or development of the fungiform papillae on the margins of the tongue. By about 11th to 13th week, we have the development of filiform papillae which cover almost the entire dorsal surface of the tongue. So, this is the timeline in which the development of the lingual papillae occur.